Hi, and welcome back to the channel. We're going to cover lower urinary tract symptoms in men today. Without a doubt, this is one of the most common aspects of men's health that will present to your surgeries on a daily basis, with 30% of men above the age of 65 having troublesome LUTS symptoms, so having a solid understanding of this is critical. LUTS can be basically divided into three separate entities. Storage problems, which include urgency, daytime frequency, incomplete emptying and nocturia and incontinence. Voiding problems, which include hesitancy, weak stream and terminal dribbling. Or post-micturition problems, which usually include post-micturition dribbling and incomplete emptying. Often, the above problems overlapped, and the clinical presentation and the underlying pathology may contribute to a non-specific set of symptoms. But some of the more common causes relating to LUTS in men include benign prostatic hyperplasia or benign prostatic enlargement, bladder outlet obstruction, overactive bladder syndrome or detrusor overactivity, urinary retention, be it chronic or acute, neurological causes or diabetic neuropathy, iatrogenic, usually from antimuscarinic drugs and sedating antihistamines, and obviously malignancies of the urological system. Generally speaking, there are a number of risk factors which predispose LUTS in men, including increased dihydrotestosterone levels, obesity, metabolic syndrome, diabetes, increased fat and red meat consumption, prostatic size and inflammation. But when it comes to establishing a diagnosis, it's key to take a thorough history to explore storage symptoms, voiding symptoms and post-micturition symptoms. On examination, you'd want to look for signs of a distended bladder or perhaps inspect the genitalia to rule out any phimotic or meatal stenosis as a cause of symptoms. Examination of the prostate is a way to establish the size and character of the prostate, and you can also use a urinary frequency volume chart or an International Prostate Symptom Score, or the IPSS, which helps distinguish and establish the severity of symptoms. A urine dipstick is also useful to assess for infections or diabetes, as well as assessing blood tests for renal function as well. And you can consider testing for prostate-specific antigen if indicated, but often patients may need extra counselling on this given the poor sensitivity of the test. Key to this is ruling out serious causes such as malignancies or infections as well, but this will be discussed in a future video. As mentioned, it's pretty important to know what the predominant foci of symptoms are, and not just treat all LUTS with the same management. Voiding symptoms can be managed in a number of ways, but you can start off with a watch and wait approach, whilst also focusing on pelvic floor training or bladder retraining. Lifestyle advice based around fluid intake and a healthy lifestyle can also be considered. If this isn't appropriate, then alpha blockers such as tamsulosin should be considered and reviewed in 6 weeks. If the patient has a large prostate, however, a 5-alpha reductase inhibitor such as finasteride is usually considered. If the patient has a combination of voiding symptoms and an enlarged prostate, then combination therapy can be considered. If, however, the patient has worsening severe symptoms with storage and voiding that persist despite alpha blockers, then second-line medications such as antimuscarinic therapy such as torteridine, solifelicin and oxybutynin can be considered. After this, urological advice really should be sought. In overactive bladder patients, lifestyle changes should be considered first, with bladder retraining considered early on. Pharmacological therapy is considered if the above doesn't work, with antimuscarinic therapy such as those listed above considered. If this doesn't work or isn't tolerated, medications such as mirabegron are considered. After this, urological advice really should be sought. In stress incontinence in men, management is a little bit more difficult. Getting advice from the incontinence team or urology early may be indicated. And if the symptoms are caused by prostatectomy, then pelvic floor training should be considered before any secondary care referral. If, however, the symptoms are not related to a prostatectomy, then urological advice should be sought early. What about those presenting with post-micturition symptoms? Well, as odd as it may sound, you could advise the patient to milk the urine, which helps some of the muscles around the urethra expel excess urine. But it's worth noting that NICE recommend that at any point in the above symptoms, considering a referral to the incontinence team is useful if it's warranted. It's also worth noting that medication above comes with its own side effects and problems too, so it's worth considering this on a case-by-case basis. Well, we hope that helps. That was a quick overview for LUTS in men. We really hope you enjoyed the video and hope it helps you revise for exams. Please be sure to like and subscribe if you loved the video, and please send it amongst your VTS or revision group. It really means a lot to us. Please leave a comment below, and if there's anything you'd like us to cover, let us know. If you haven't done so already, check out our website www.dorkydocs.com, where all of our content is available for you. But otherwise, we'll see you in the next video.